This is an example of a fairly rare skin lesion called an apocrine hidrocystoma. Apocrine hidrocystomas are benign skin lesions arising in adults usually between the ages of 30 and 70. They are a type of adenoma, and grossly they are dome-shaped lesions, usually solitary, but they may be multiple. The size is around 3 to 15 millimeters in diameter, and often they have a bluish color. And sites they arise on include the face, ears, scalp, and neck, but normally on the face. Histologically, there may be one or more cystic spaces in the dermis, and these cystic spaces are lined by a double cell layer with an outer layer of myoepithelial cells and an inner layer of cells showing decapitation secretion indicative of apocrine cells. In areas, the inner layer of cells may be papillated. Another feature you sometimes see in apocrine hidrocystomas is the presence of a dense collagen cuff around one or more of the cystic spaces. Here is a low-power view of an apocrine hidrocystoma, and the arrow is pointing at the dense collagen band around the cyst in the upper dermis. Here you can see papillary projections into one of the cystic spaces. And here the decapitation secretion of the apocrine cells is very nicely seen. The apocrine cells have abundant deep pink cytoplasm, and the tops of the cells break off, hence the term decapitation secretion. In this area you can clearly make out the two cell layers with the outer layer of flattened myoepithelial cells and the inner layer of apocrine cells. Sometimes it can be difficult to determine if the cells lining the cystic spaces are apocrine or ecrine if they are flattened. So a simple solution is just to call the lesion a hidrocystoma.